Hello, everyone, and welcome to an audio podcast in this series, the Pathology Storm. This is an audio podcast in collaboration with the Renal Patient Support Group, the RPSG. It's a Storm Robotics production in collaboration with the RPSG, and this audio podcast is going to be an overview around the anti-inflammatory agents on COVID-19 recipients, and this audio podcast, again, as with others in this series, is part of the Shientist Chartered Edition. I'm your host, the Shientist. The full works around this have been highlighted in a peer review, invited peer review manuscript and publication, and will be available through the RPSG in due time. So, anti-inflammatory agents on COVID-19 recipients. So, as sort of mentioned in part of in part of the previous audio podcast, many factors might induce organ dysfunction. Organ dysfunction syndrome, circulating cytokinesis storm, which might be induced by superimposed septic syndrome, or directly by virus, causes severe damage to the body. And so to ease organ damage, the usage of anti-inflammatory drugs was suggested to ameliorate COVID-19 infections. So, in relating to this, I'm going to talk a little bit. I'll highlight a little bit around some of these anti-inflammatory agents. So, steroids. So during SARS-CoV, during the SARS-CoV outbreak in 2002, 2003, again that stemmed from the Wuhan province in China. The use of steroids was restricted due to the lack of beneficial results and possibly harmful side effects like delayed viral clearance, avascular necrosis, and other health conditions. Corticosteroids were observed to increase the mortality among SARS patients, which indicates the danger of using steroids to ease COVID-19 symptoms. In following, there are other anti-inflammatory sort of agents that have been investigated for COVID-19 for patients who have COVID, or suspect for COVID-19, or have COVID-19. Some other sort of treatments are known fall under what are known as the JAK-STAT inhibitors. So the JAK-STAT signaling pathway is present within various cells, and has been associated with various roles in immune responses like interleukin-2, interleukin-4, interleukin-6, interleukin and interleukin-12 signaling. Now, anti-helper 1, T-helper 2, T-regular T-reg cells, and Th9 Th17 cell differentiation, and the proliferation of viral selective CD8 T cells and B cell lymphoma. So all of these sort of immune responses are are part of signaling pathways to particular conditions, but also where JAK-STAT inhibitors in some regard have premise. So the presence of a cytokine storm is essential for dealing with a viral infection. However, as mentioned, cytokine overload might induce organ damage or severe conditions like acute respiratory distress syndrome. A solution has been suggested that JAK-STAT inhibitors may or might decrease the level of pro-inflammatory cytokine, resulting in general improvement of health among COVID-19 patients. However, a lack of an appropriate amount of cytokines may lead or might lead to a compromised immune response or immune responses and proliferation of the SARS-CoV responses, and thus proliferation of SARS-CoV-2. So currently, investigations or studies of JAK-STAT inhibitor treatments, for example, baricitinib or baricitinib, provide promising data showing a reduction in the number of deaths among COVID-19 patients. And while it is known that COVID-19 impacts renal function or kidney function, leading to increased mortality, and cytokine response of renal epithelium has not been investigated in detail. In this works, or in the works, my colleagues and I have highlighted that genetic programs report genetic programs activated in human in the works. My colleagues and I had identified works where investigators report on the genetic programs activated in human primary proximal tubule or HPPT cells by interferons and suppression by a particular drug under the same JAK-STAT under the same JAK-STAT umbrella, and that is a treatment known as Ruxolitinib, and it's a Janus kinase or JAK inhibitor used in COVID-19, as well as other tissues that permit the avenue of kidney-specific interferon responses. Additionally, new drugs such as Ruxolitinib are also being trialed further, and recently discovered isoform of the same sort of pathway, and initial data informs that show promising sort of data linked to human primary proximal tubule cells of the kidneys aligned to ACE2 and the SARS-CoV-2 receptor. Also, there are in relating to anti-inflammatories and other forms of other treatment pathways, cell-based therapy, so mesenchymal stem cell therapy. So cell-based therapy, particularly stem cell therapy, has emerged as a potential therapeutic, with many seeing prospects to heal incurable illnesses. The research surrounding stem cells continues to generate intrigue due to the potential, including a high proliferation rate, low invasive procedure, and are free of a particular sort of ethical issues. Among COVID-19 patients, stem cells focus on modifying immune cell function, immune responses, and reduced inflammation immune responses and reducing inflammation induced lung injury. Those stem cells, the stem cells also produce growth factors, which promote cell proliferation and prevent apoptosis. So in the peer review manuscript in the works, there is an illustration that provides an overview surrounding the visualization and mode of action during mesenchymal stem cell therapy in COVID-19 patients. I won't highlight the illustration in this audio podcast. However, the decrease in mortality has been observed in several studies which focused on the usage of mesenchymal stromal cell MSC therapy amongst COVID-19 patients, and additionally mesenchymal stem cells significantly shorten the time to clinical symptom improvement in COVID-19 patients. Several clinical trials have shown MSCs are effective and safe for treatment of COVID-19 patients, particularly critically ill patients, reducing clinical symptoms, hospital stays, cytokine release, and mortality and mortality. That ends this audio podcast on this particular part of the works around anti-inflammatory agents on COVID-19 recipients. This is an audio podcast, part of the Pathology SZtorm, part of the Shientist chartered edition. It's a SZtorm Robotics production in collaboration with the Renal Patient Support Group, the RPSG. I want to say thank you for taking the time to tune in. The next one, the next audio podcast is will be the final audio podcast where I'll provide a summary and a conclusion and an overall sort of backdrop to this work, to the works in the form of an abstract. So again, thank you for taking the time to listen, and hopefully the next with the next one, those listening can get an overview through the summary and the conclusion. Thank you.